Welcome back, folks. Continuing our segment here on Rise and Shine in partnership with OU Health. We want to keep all of our Rise and Shine viewers feeling good, of course, and the three doctors right there on your screen will be sharing some tips to make sure you stay that way. Each one of them will join us 3 Fridays in a row with a week off to reset, and then we'll roll and keep it going from there. This is the end of our first 3 weeks with our OU Health experts, so we'll have them back here in just a couple weeks. Today's topic, what every Oklahoman should know about cancer screening and genetic testing in the year 2026. Joining us this morning to share more, Dr. Michael Cookson with OU Health Stevenson Cancer Center Deputy Director. Sir, appreciate you being here this morning.
Thanks for having me.
Absolutely. So we always hear the phrase early detection saves lives, right? Very important. Talk about why that is important.
Yeah, so when we talk about early detection and screening, we're talking about finding that cancer before it becomes symptomatic. It's smaller, it's localized, it's early, and so all the things that come from that, like treatments can be more localized, a single treatment, recovery, less side effects, and cure. So that's what we hope for rather than waiting for things to advance.
Absolutely. So critically important at that point. So, and we always hear too about the big 4 cancer screenings, right? We're talking breast, cervical, lung, and colorectal, right?
Yeah.
So kind of talk about those and just the importance of catching those early and those different screenings and who should be getting those screenings, I guess.
Yeah. So when we talk about screening, we want to find evidence in the literature that there's like improvements in your outcome. And that for those kind of cancers that you just mentioned, for lung and colon and breast, even prostate, there's improvement in the survival. So we know that doing that early intervention screening can save your life. 1 in 3 men and women in the United States will get cancer. And
it's insane.
It's really a high
statistic.
amount. And if you think about it from a standpoint, you know, we have the same amount of cancer, but in Oklahoma, there's barriers to getting access. So much rurality. 1/3 of our patients live in areas that really don't have good access. So if you combine that with some high levels of smoking, maybe obesity, not doing as preventive the type of things, that's where we can really make a difference.
And another thing people think about, genetics, right? Family history. Like my grandma ended up with cancer later in her life, and I guess I'm curious to add on to this question. Is it more prevalent early, later in life, middle of someone's life, or does it just depend on the person, and what role does family history play in this?
Yeah, family history is an important thing. It's often overlooked, and so if you don't know your family history, you should try to learn it and give it to your doctor so they can understand. But the screenings that you asked about, so women, say age 40, start getting mammograms. About 70% of women in the state of Oklahoma do that, but we're missing 30%. Only about 1/3 of men get a PSA test. So your family history matters. If you have a first-degree relative, a father, brother, that matters, and then multiple family members, even more. And so the other thing we've learned is it isn't just like prostate cancer for prostate or breast cancer for breast. There's clusters and patterns that develop, and some of the genetics shares commonality. So lung cancer, colon cancer, these things can be a signal that you need more testing, and that can be genetic testing.
And there's some general testing, genetic testing. Kind of talk about blood tests, right? Who needs to think about those? How have those developed over the years, and what do people need to know?
Yeah. So for a routine blood test, for example, PSA for prostate cancer, that's been out for a long time. But there's a new emerging area where there's these genetic fragments that can be tested for, multi-cancer blood tests. They're not truly FDA approved yet. They're working on that, so they're really early. But these are opportunities for us to test for cancers that don't have a good screening mechanism. So for the big ones that you talked about, we have a mammogram, we have a PSA, we have colonoscopy, we have some blood tests for that as well now. But for the cancers that we really don't have good ways, pancreatic would be a perfect example. We need to use some of these new tools to be able to detect that. We also didn't mention lung, and lung cancer is an area where really the state of Oklahoma suffers. We are in the bottom in terms of worst outcomes, 4th in the United States for lung cancer. So we need to do screening with low-dose CT scans to try and detect that. And those are men, say anyone that's 50 years or older. If you have a smoking history or a former smoker, you should be getting those kind of screening tests.
Dr. Cookson, sir, thank you so much for all the great information. It's absolutely perfect. We appreciate you joining us. We'll have more Feel Good Friday right here on Rise and Shine in just a couple of weeks. Of course, we'll reset and then rock and roll for 3 straight weeks from there. Appreciate you being here, Doctor.
Thank you.
Back with more after this.